Now we have to move to the next panel discussion, moderated by a great friend of me and a professor of microbiology, infectious diseases, and distinguished chair of global health in Huck Institute, associate director. And he is one who has a lot of insight into African issues, particularly in zoonotic diseases. In fact, through him, I came to know lots of things that are happening in terms of projects and programs. And I now request Dr. Vivek Kapur to conduct the rest of proceedings. I should also share a pleasure with him to all of you that we are the ones who successfully, after several discussions and negotiations, started a bovine tuberculosis network in India. I think still it's going on. There are hurdles, but I'm sure the goals will be definitely achieved. I am very proud of inviting Dr. Vivek Kapur. I'm sure he will lead the panel smoothly. Thank you. Over to Vivek Kapur.
Great. Thank you so very much, Professor Rao. Real pleasure to see you again, sir, and everyone here on this meeting. It's again a real pleasure to be part of this. As Professor Rao introduced me, I'm Vivek Kapur. I'm a chair in global health and background in veterinary medicine. I'm also an adjunct professor at the Nelson Mandela African Institute of Science and Technology in Arusha, Tanzania, where it's been a real pleasure to have worked on with colleagues, very closely with colleagues on projects founded by the Bill and Melinda Gates Foundation, the US Defense Threat Reduction Agency, amongst others. It's a real pleasure today to introduce to you our panel, who's going to discuss critical bottlenecks and opportunities for implementation of One Health programs of particular interest to low and middle income countries. That is where many of us work. That's where many of the issues that are of relevance to us are. And so I think this panel discussions going to be particularly illuminating in setting both the agenda and asking how it is that we might be able to overcome what these bottlenecks are. So we have an outstanding group of panelists. Let me introduce them one by one. First off, you've already heard from Dr. Jimmy Smith, who's the Director General of ILRI, the International Livestock Research Institute. Dr. Smith has served as Director General of ILRI since 2011, has extensive experience in livestock health and research related activities, including at CGIAR, working with the World Bank, as well as with the Canadian International Development Agency. He's worked for quite a while at ILRI, and I think his experience in the field has been tremendous. So welcome, Dr. Smith. I'd also like to welcome Dr. Bhupendra Nath Tripathi, who's Deputy Director General of Animal Sciences at the Indian Council for Agricultural Research. Dr. Tripathi and I've known each other for a while, but he currently leads and helps establish the research agenda for what is about a quarter of the world's livestock population and about an eighth of the human population in India. Professor Tripathi is trained in veterinary medicine, has extensive experience in the area of infectious diseases, including being widely published, and particularly in areas including Johne's disease, where he and I have worked on for a while. And prior to his role at the ICAR, he served as Director General for the National Research Center on Equines and helped establish the Indian National Center for Veterinary Type Culture. Welcome, Dr. Tripathi. Our third panelist is Dr. Jean-Philippe Top, who you also just heard from. He's Deputy Director General of the World Organization for Animal Health, the OIE, where since 2016 he's led institutional affairs and regional activities, really overseeing a lot of the implementation of critical regional initiatives, including those that relate to One Health. Dr. Dap has a background in veterinary public health, as well as in tropical veterinary medicine and animal production. Has served in many different roles across the world, including in Africa, where he started his career in Burkina Faso, and then moving on to France, Spain, and elsewhere. And now, of course, he's involved with international affairs. Welcome again, Dr. Dap. We also have Dr. Silas Obukosia, who's a Senior Program Officer at the African Union Development Agency, a co-sponsor of this program. Dr. Obukosia has, it's a pleasure to introduce him, particularly because he and I are graduates of Penn State, so we're alumni of Penn State, so welcome. His background is in genetics and molecular genetics and in plant breeding, but has quite a bit of experience in areas that have incredible relevance to us, including biosafety, intellectual property rights, and has served in important roles in various places, countries in Africa, particularly in Kenya, where he's worked with the Bill and Melinda Gates Foundation, and as well as serving in roles in advising the US Agency for International Development in its biotechnology program. So welcome again, Dr. Obukosia. And then finally, a co-founder and a critical member, one of the triumvirates of ICAR, Dr. Sachin Chaturvedi, who's Director General of Research and Information System for Developing Countries, also known as RIS. This is an India, New Delhi-based think tank, and his experience and where his current work is focused is on issues related to development economics and development finance, particularly interested in South-South cooperation, which, as you heard early on, Dr. Rao suggested is really the reason for forming ICAR to try and move the South-South agenda forward. Dr. Chaturvedi has a lot of experience in areas of trade, investment, innovation, and is also a member of the Board of Governors of the Reserve Bank of India. He's published over 20 books, including in policymaking, and is I think one of the foremost leaders in external sector economic engagements and partnerships. So welcome, Dr. Chaturvedi. Just a brief background here. Our session objectives, as I suggested, are to discuss critical bottlenecks. We have a limited amount of time, and so we're going to start with very brief introductory statements by the panelists, where they lay out in their views what the key challenges and opportunities are for implementing what we recognize to be as One Health related programs of relevance to low and middle income countries. The request is for each of the panelists to stick with about 4 minutes or less so that we can lead on from that to our discussion, where we will spend about a half an hour, hopefully. So again, I'm going to start off. First off, perhaps Dr. Smith, I don't know if you have slides, or would you like to just simply discuss in the next 4 minutes? Welcome and thank you.
Thank you, Dr. Kapur. No, I don't have slides. I just have a discussion. First, I must say, with the lineup of panelists that you've just outlined, I feel a sense of inferiority complex lining up against these luminaries. However, let me have a go. Some challenges. We hope that we can find ways to prevent zoonotic diseases with or without pandemic potential, but perhaps that's some distance away. If we were able to detect them earlier, we would still be able to save a lot of resources. As we know, the further away from detection, the higher the cost of control. So in the current set of circumstances, a key challenge is surveillance. How do we do surveillance that allows us to detect diseases of pandemic and non-pandemic potential much earlier than we do now? First challenge. Second challenge is how do we get better institutional collaboration? The sum of the parts is much less than the whole at the present time. Institutions work vertically. What is my mission? What is my job description? What's my remit in this issue? We want a more, rather than a vertical, a more horizontal approach to dealing with the disease prevention and control. So rather than what is my mission, we need to ask what is the mission to be accomplished. So we must work more horizontally and less with these rigid institutional boundaries. And the third is how do we create incentives so that we can get early detection and response much sooner than we do now, from farmers, from rural communities, from rural governments, national governments, and across governments. As you know, the story of South Africa recently announcing the Omicron and the whole set of issues which arose that were quite punitive of South Africa at that time. We will not be able to achieve early reporting and therefore early response if when things are reported early by farmers or by governments, the actions are punitive. So how to incentivize actions that are not punitive that will also trigger early response? The benefits, therefore, are the converse of those things, I would say. If we were able to do early detection, we will derive a lot of benefits. In earlier work of mine and colleagues at the World Bank, we estimated in the days of high-path avian influenza that $25 billion over 10 years will bring us benefits of about 125 billion. Now, this was in high-path avian influenza, very mild pandemic. Put that in the context of the current pandemic, and one can see what might be the returns on investments in surveillance, particularly in low and middle income countries that are not able to afford it. We will derive so much more from this institutional collaboration about which I spoke in the area of animal human health and environmental health. These investments will present a lot of opportunity for us to do much more than we do right now. And we will foster a virtuous cycle by bringing about this institutional collaboration, such as been spoken about the tripartite +1. And then we must do the opportunities as much more in communication and education. At the present time, our approach, and until now, we learned from the pandemic that the approach that is largely about the economic returns is not all. We have learned about the real social and other costs of these pandemics. So education and communication are really big opportunities for us. Thank you, Dr. Kapur. I rest there for the moment.
Great, many, many thanks, Dr. Smith. Dr. Tripathi?
Thank you, Dr. Kapur. I'm audible?
Yes.
Okay, thank you. Thank you very much for providing me this opportunity. And the agenda has already been set by the previous speakers and also by Dr. Kapur. I would like to highlight that how India has been working in just a couple of minutes and how it's trying to tackle the One Health issues with various programs that have been run by Indian Council of Agricultural Research, One Health approach, then by Department of Biotechnology and Department of Health Research. And of course, and every program that Indian Council of Agriculture Research is collaborating with them. One of the most important programs that we have started in the country by Department of Health Research, where they have divided the entire country in 16 regional coordinators, where every regional coordinators have got 3 to 4 states, and where both veterinary and medical institutions are collaborating. They're developing laboratory infrastructure. And that's a very unique thing, where we are all tackling the local zoonotic problem there, trying to help our stakeholders also, and developing a type of a common laboratory there. So that is the one thing that has become very good. And at least we have been able to set up 12 regional laboratories like that. And a part of that, Government of India is also trying to strengthen the capacity building to the World Bank project. And also we have been trying to work with the ILRI, on some of the exotic diseases. And our international collaboration is already on with ILRI, and both Dr. Dieter and Dr. Smith is here. And now we are trying to develop them, working on the exotic diseases, including MERS coronavirus and Rift Valley fever. So that is the one thing that we have very, very soon we are going to start with the international collaboration. Now, some of the critical bottlenecks that I have been observing in our country and maybe other countries also, that there should be enhanced collaboration between medical and veterinary institutions, because we have seen that how this COVID pandemic has really devastated the entire world economically in all fronts that have been affected. So let us have some of the common laboratories, a shared responsibility for handling these zoonotic diseases. Then strengthening infrastructure. We have got limited numbers of BSL-3 and BSL-4 laboratories. And in India itself, where we had only 1 or 2 laboratories when pandemic came, but now we have almost more than 3,000 laboratories. So this preparedness should always be there on a war footing. As Dr. Soumya has very clearly said that when next pandemic comes, we will never know it. Then third thing is international collaboration. That is very, very important. And also the human resource development of diagnostics and vaccine, though we have been developing it, but now we need to change the vaccine development pattern also. We have to skip many things while developing the vaccine. Earlier vaccine development used to take maybe around 6 to 8 years. And also, I see a very commonality between veterinary vaccine and animal vaccine. Why can't we approach one health vaccination for many diseases like tuberculosis, like brucellosis, like Rift Valley fever? So that approach, we have to go for that. And then finally, the greater investment on animal health, that is lacking in all countries, including India. So that has to be taken care of. And then human resource development to deal with such like pandemics on a very short notice, and then effective communications. So these are some of the things that we have to really work on this, so that we can really we can tackle and handle with the this pandemic, and also in the future whenever it comes to. So this way, thank you very much, Dr. Kapur, for this present.
Great, thanks for your introductory statements. And Dr. Tripathi, very good to see you again, sir. Dr. Jean-Philippe Da.
Thank you. As you can imagine, I'm very happy to hear that we must invest in animal health. So I strongly support this. But as you ask me, what are the 3 most important challenges? I will mention first to make One Health not being a nice concept, theoretical concept, but really a reality implemented in the field. And this needs to relate to different themes, starting an initiative, many One Health initiatives could be listed. OLEP started to list 160 around the world, and we will need a mapping to better understand which are the significant ones, the most important one, and also to ensure a good coordination between all these initiatives. But for making One Health a reality in the ground, we need capacity building. We need to invest in capacity building, and this is, of course, a challenge. The second challenge I would like to mention is to ensure a good continuum, a good articulation between what I call the risk analysis step and the risk management and control step. So for risk analysis, we need science, we need anticipation. It was already mentioned. We need bodies like OLEP, but perhaps over connections. We need to rely our actions on a strong risk analysis system, and then to promote a strong risk management system, again, by supporting our members and by investing in this support. And as a third challenge, I would like to mention the importance of data management. Data is also the key for anticipation and prevention, starting with the identification of emerging threats, the identification of emerging animal outbreaks. It is what we do through our World Animal Health Information System. But we need to break silos and to connect this information system for animals, for example, with the human animal health system, with the environmental health systems. We need to share data, and we need to do this with a good understanding of what are these data. WHO recently announced the creation of a new pandemic and epidemic global intelligence hub in Berlin. So that means that other organizations, starting with WHO, invest in data analysis, in data productions, in data sharing. So this is very important. But at the same time, the current pandemic offers new opportunities. So I mentioned data sharing, which is at the same time a challenge and an opportunity with the creation of the One Health Intelligence Hub. But as an opportunity and to remain at a global and multilateral level, I would like to say that the current context encourages us to better cooperate together. We mentioned already the tripartite, what we call today the tripartite plus, which includes UNEP, to better consider the environment health. We succeeded to set up OLEP in a very short time, only 3-4 months to set up such an important body. We generated numerous applications to join OLEP, more than 700. We work efficiently with them. There is a good articulation with the Tripartite Plus. We have a bureau each 15 days. We will finalize very soon the global plan of action for One Health. So you see, this generates a lot of energy, a lot of dynamics, and this is very positive. As a second opportunity, I want to mention the increase of the political interest, the political commitment for One Health. Yesterday, perhaps multiple politicians didn't know what was One Health, just a word. But today, they know what it is. We have more opportunities to promote One Health in G7, in G20. And this time, G20 is discussing together with the World Bank a new mechanism to establish a better funding for global health, including One Health, through a financial intermediary fund. So it is not only political interest, but I hope it will be translated in financial support to global health and One Health. And as a third opportunity, I already mentioned that several times. I think that today we realize better that not only animal health and human health are connected, but both are connected with environmental health. This has also a positive consequence, starting from OIE. I could mention the wildlife framework that we developed, and we are currently implementing this framework. Better cooperation with UNEP, which is very important in this field. So I expect this cooperation to be more and more important, and I want to be optimistic on our capacity to address the different interfaces of One Health. Over to you.
Great, thank you very much, Dr. Dab. Dr. Silas Obukosia.
Yeah, thank you very much. I want to thank Professor Gassam, who is our APETI chair. I want to thank also Barbara, my colleague, and Dr. Karim also. Yeah. I think we are focusing on the African perspective regional approach. So there are three main opportunities. One is the policy and regulatory framework at the continental level. Yeah. Now, we have got various policies that could support veterinary, One Health, and human health, and many of them are already operational. One of them is the Agenda 2063, the Science, Technology, Innovation Strategy for Africa, then also the Africa Continental Trade Agreement here. But one of the interesting things is that the program which I work with has been working on a biotechnology policies for Africa, and we are in 23 African countries. The laws that have been established in these countries are both can be used for animals and also for plants. Yes. There are things that as we move into the new area of science like genome editing, we are also have a policy draft for Africa, which Professor Gassam and the group shall approve. And this forms a framework for impact in the whole of Africa. And one of the interesting programs that's interesting to health is that the integrated vector management program, yeah, where we are supporting the biosafety section of developing gene drives for control of malaria in Africa. And currently we are in 3 African countries here. So those are just an example of the policy framework on which One Health can build on here. The other one I think is the ongoing research. I think Dr. Jimmy may have mentioned, but his institution is doing a lot of research in some of these diseases, like contagious bovine caprine, like Rift Valley fever, East Coast fever, and there are about 11 applications that are being done at containment in these diseases, most of them carried up by ILRI, but approved by the Kenya National Biosafety Authority. So in short, there are platforms that can be used for that. The other aspect that is a strong opportunity is regional platforms. For example, there is a WAHU, West African Health Organization. There's a platform for a gene drive for elimination of malaria. There is CORAF, which is doing regional harmonizations on biosafety. There is COMESA and other bodies like PAMP. In other words, if you want a regional approach to have a bigger impact of more than one country, we have got those platforms here. Now, the challenges, one of the challenges that comes out strongly is the COVID year. And there's a paper written by our CEO, the COVID, the future of Africa development year. And he mentions there is decreased GDP because of COVID, there is decreased intertrade, there is increased poverty and food security. But one thing that comes out as a strength from that report is that he feels that health must be an integral part of socio-economic development of Africa, which means that One Health is just timely, because we can't move from the experience of COVID unless health is part and integral here. One other challenge that is very, very important is that although we have got biosafety frameworks to handle gene drives, to have biotechnology in Africa, in 23 African countries we are on the ground, they have only been mostly used by plants, although they cannot be used for plants and animals here, except in a country like Kenya. So one challenge is that the animal science, the human science, the animal science need to come up with some research, with some products for this to be used and make sure that they are functioning here. So in short, there are great opportunities for Africa, which you can engage in policy, research, and platforms, but the challenges come in that the health must be an integral part of it, yes, and that these policies need to be used by animals for them to be functional. And I will stop there and I say thank you very much.
Great, thank you much, Dr. Obukosia. Dr. Chaturvedi.
Thanks a lot, Dr. Vivek Kapur. Let me at the outset congratulate Dr. S.R. Rao and Dr. Kai for excellent platform that they have created. I would very much like to congratulate the team and also the effort and the endeavor. I think the idea of One Health has come, and we would have to think of ICAR as a possibility to connect. I have Dr. Kapur put together a couple of slides that I would like to quickly share and would finish in the allotted time that you have given me. My idea is to address issues as they are in terms of what Dr. Rao said in terms of our focus on One Health, and Dr. Soumya Swaminathan highlighted in terms of better effective coordination, consensus, and solidarity that she mentioned. And I think it's important for us to realize that the 5 T's which are important are technology, trade, transport, travel, and transmission. And these 5 T's are important in terms of how we attach economic importance, the trade importance, the idea of the non-tariff barriers which come up to allow trade and economy to expand without compromising the dimensions of engagement which are there. And from that point of view, I realized that the question of our engagement, the question of our partnership would be in terms of addressing these 5 T's, which I think are important.
Dr. Chaturvedi, your slides disappeared. Apologies. Could you share again, please?
Okay. Do you have it before you now?
Yes, thank you.
Thank you. So the idea is in terms of identifying the possibilities of One Health strategy, which is more a multi-sectoral, multidisciplinary, and multi-stakeholder. So it is not just an idea that only science agencies or health agencies can govern. As was very rightly mentioned, it is something which can bring in all different actors, including the actors which are part of the international relations, diplomacy, trade, and technology management. It is important for us to realize that LMICs require support. They need resources, they need technology, they need finance. And for that, the idea of partnership among the southern countries for South-South cooperation, SSC as it is called, and also partnership with the North, because northern governments were equally affected. So that is called as TRC, the triangular cooperation, and the South-South cooperation. So the whole approach would be to have the One Health concept for LMICs and bringing in the effective global guidelines that are needed, institutional mechanisms that are needed. And these dimensions can help us manage the big data, the digital traceability, and they can actually be playing an important role in the travel restrictions that have come up, or even the trade curbs that are there. We need to overcome that because economy has to expand, and without expansion of economy, it would be difficult for the southern economies and even for northern to assist the south. We need to see that we expand our economies, but we do not compromise on health. As was very rightly mentioned, human health is linked with animal health is linked with environment health, but health of economy is linked with all of them. And that requires us to see how several access, equity, and inclusion related issues are addressed. Now, friends, it's time for the South. This year, Indonesia is providing leadership at G20 in 2022. India would come in 2023, followed by South Africa and by Brazil. So next 4 presidencies of G20 are going to provide this. We need to see how resources can come in and can provide the necessary leadership which is needed. I would stop here and would be very much like to be linked further for any discussions. Thanks a lot, Dr. Kapur.
Great, thank you so much, Dr. Chaturvedi, and thank you to all of the panelists for their opening statements, where I think common threads were pretty clearly made apparent. Primarily around the challenges which are relating to not only the challenges for cooperation, integration, and the economic challenges, the challenges around prioritization, communication, and a fairly long list that we heard about. But then those challenges as opportunities as well, particularly around how we might be able to effectively implement One Health as a larger agenda, move it from what I think was called conceptual framing to reality, to practice, how we might be able to resource it, and then actually start to see what the progress on the ground might be through real-world examples of particular relevance to low and middle income countries. So thank you for that. I think the primary goal, as we know, is to focus on low and middle income countries. And I'm wondering, with the South-South cooperation or the triangular cooperation agenda that Dr. Chaturvedi mentioned, I'm wondering, how might we empirically establish what one would call the value proposition? Indeed, I think, as was already mentioned, governments now know what One Health is, but how might we empirically establish this value proposition? Because in the long term, in order to sustain this, once COVID is done and over with, I think people will simply want to move on. And I think the best opportunities, as Dr. Chaturvedi mentioned, and Dr. Smith mentioned, is to establish this as a value proposition right up front. So how might we do that? Dr. Smith, do you want to take a first crack at that?
Well, I think a good bit of that is being done already with the many studies that are coming out to show the impacts of a pandemic such as this that illustrates the value of One Health approach. We have seen studies not only about the impacts on economies, but also the impacts, social aspects of it, including health and education and so on. So the value proposition could partially be based on the returns on investments that we can make, given the assessment of what this has cost us. We certainly should come to the position that this should not happen to us again, at least in this scale. And we should not find ourselves as disarray as we are now. So I think that part of this value proposition is establishing the baseline that this pandemic has set for us as certainly a guide as to things that we do not want economically, socially, and otherwise.
Yeah, thank you for that, Dr. Smith. So you mentioned the World Bank had said that there was about a 5-fold return on investment for, on influenza, for example, on the avian influenza part. But yet it seems that the opportunity costs might have been greater, with potentially more returns of investment seen in other places. And so that investment was really never made at an adequate level, of course. And I'm wondering, are there lessons to be learned that we will forget, that this pandemic will go, we will forget this, but yet that economic part really needs to be emphasized, and we need to show the value proposition as the trade-offs on opportunity costs. And it's not entirely clear to me where that might be coming from. Your thoughts on that, and then perhaps Dr. Chaturvedi, you could comment as well. You're mute, sorry. Yeah.
Sorry. Those who work in financing, whether it's development financing at the national level or global levels through the IFIs, find themselves in a situation where the demand for resources far outstrip the supply of these resources. And because of that, funding tend to be sort of lurching. We lurch from one problem to the next. And this has happened in the case of, we know many of the things we need to do to minimize the impacts of pandemics, but we don't do them because once it's over, we have moved on. Someone proposed in the comments foregoing in this session that maybe this has been a big enough jolt that politicians in particular would now know what One Health is about, will now understand the impacts of investments to prevent, because the cost of control are infinitely larger. So I'm hoping that that is the case, that this was sufficiently impactful, not only in economic, but social, psychological terms, that we will not walk away from this without maintaining a minimum level of investments that will guarantee us the returns, that not only the cost, but the opportunity costs are reduced.
Great, thank you. Dr. Chaturvedi?
Thanks, Dr. Kapur. I think three issues to me, they are extremely clear, being very closely linked with development finance and its management, both at the global and at the regional level. I have been very closely watching the way IMF has responded to the crisis, and with the new proposed reforms of the spatial drawing rights, SDRs. Now, after G20 repeated requests, IMF opened up a spatial window, and reforms of SDR led to providing something like $675 billion. And out of that, $375 billion have gone to OECD countries themselves, and only $21 billion has come to the low and middle income countries. So this lopsided approach that we have at the global financial architecture in terms of exclusion of the countries where huge masses are dependent. Africa has yet to have the quantum that is desirable for vaccines, and the amount of protection that is needed, the vulnerability has multiplied. The repeated exclusion of Africa and continent in terms of both development finance and also in terms of their ability to cope up with the health crisis, I think is an important dimension that is there. The second point is in terms of what goes beyond the public health impact of the regional and global emerging crisis, both in terms of endemic infectious diseases, but also in terms of the socio-economic consequences that it brings in. And that, Dr. Kapur, requires the amount of information that is needed for resources, for key partnerships, both public and private, but also in terms of the preparation for potential infectious diseases, as Dr. Swaminathan mentioned. So it requires a huge effort now to bring that in as part of our response architecture. And this is important in terms of the whole development finance architecture that is needed. The fact that the OECD has now talked about, as Dr. Kapur, you referred to in terms of triangularity, more and more institutional architecture would have to be revisited. WHO is not part of the conversation in terms of how the finance is moving, but I'm really afraid it would require to be so. Japan in its presidency and Italy during its G20 presidency has for the first time organized meetings of finance ministers and health ministers. This convergence has to come in, and this convergence not at the apex level of ministers, but also at the level of what Dr. Smith rightly said in terms of the regulatory architecture. The regulators would have to come together both for finance and those who are responsible for health, infectious protection mechanisms. And that would be the way forward for idea of One Health. Otherwise, it would just remain a slogan. It has to turn into practice. It has to turn into the reality that is needed. Thank you.
Great, many thanks for that. Dr. Dopp, your experience in this, I think you're the one who brought up the point that there is this awareness, and yet in your role from the OIE, with the work you've done with putting together OLEP and others, you're seeing this awareness and this interest come through. What mechanisms and what approaches are you seeing to build on this necessary, not only sustained interest, but ensuring that investments follow this interest, as Dr. Chaturvedi said, and that is sustained. Dr. Dopp, your thoughts?
Thank you, Professor Kapur. Yes, and I would like to elaborate on what Professor Chaturvedi said. We gain more interest from politicians, from the highest level. He mentioned G7, G20, but we must now transform interest in money, in budget, in investments, in One Health. So we are part of these discussions as observer organizations. WHO is more in front of the scene together with the World Bank. We have proposals on the table through new mechanism involving the World Bank and the creation of a task force to discuss future investments, which secretariat could be operated by the World Bank and One Health. The next meeting of G20 on that will take place on 26th of January. Of course, we will participate. But when I see the documents that we received for this meeting, I see global health, but I don't see One Health. So that means that as the 4 members of the Tripartite Plus have to continuously remind that One Health is part of global health, that veterinary services, for example, are part of the health workforces. And when we invest in One Health, we prevent the future pandemic, we strengthen multilateral cooperation, and we are more efficient. And being more efficient, it's more value for money. With the same amount of money, you get more impact, more results. Because in fact, what is important is not to get money to develop activities, but to monitor if these activities have a true impact in terms of health and in terms of prevention of the next pandemic. And we should avoid what I call the one-shot investments. I will take the example of our World Animal Health Information System. We need to modernize the system. We are currently doing this, in particular to include the interoperability function, which will allow data sharing, which I mentioned previously. But this investment must be continuous, and we call it evolutive maintenance of our information systems. So yes, we must get more interest from the highest level, from the political level, but we need long-term commitment and investment to have a true impact on the prevention of pandemics and to better support our members. And one of the things I didn't already say is that when we invest in health systems, in veterinary systems, we are not only preventing the future pandemic, but we are also preventing what we call the transboundary animal diseases. That means also diseases which are not zoonotic. When we have strong laboratories, we have strong capacity of surveillance, and this surveillance is also useful for zoonotic and non-zoonotic diseases. Over to you.
Thank you very much, Dr. Dub. Again, I think both the challenges and opportunities for trying to show this value proposition that might result in sustained investment is going to necessarily be a continued point of discussion. It seems, I think, Dr. Chaturvedi, as you mentioned, the health of animals, humans, the environment is inexorably linked with the health of economies. And I think it's that virtue cycle that will perhaps drive this sustained investments that we've all spoken about here. In terms of the other point that I think in both terms of challenges and opportunities that each of the panelists mentioned is quite striking about the need for cooperation, better communication, particularly between the various domains, the stakeholder domains, ranging from human, animal health, regulatory agencies, etc. These various stakeholder groups tend to be siloed, as has been mentioned by pretty much everyone. How might we get some progress on there, particularly given the awareness of this issue thanks to COVID? Dr. Tripathi, you mentioned the formation of these new laboratories, these 16 new laboratories that have been put together, and a newfound interest in cooperation in India. Can you briefly share your experience there and how you think this might be sustained for sharing accurate prevalence estimates, identifying new priorities for these emerging infectious threats, the next pandemic?
Oh, yeah, thank you. I think the Department of Health Services, Health Research, that comes under Ministry of Health and Family Welfare. They started a program about 3 years back. So they have a plan to nominate and develop 16 coordinators throughout the country, and each coordinators will look after, depending on the infrastructure they have, 3 to 4 states. And in these 3 to 4 states, whatever zoonotic diseases that occur in that area, whether it's a medical institute or it is a veterinary institute, they will be responsible for data generation, for surveillance, for providing diagnostic services, and so on and so forth. And that has really, I've seen that is progressing. They have already nominated 12 regional coordinators, and they're all working well. For example, I was at one of the institute where I was taking care of Haryana, Punjab, and Delhi. So similarly, all coordinators, they are doing very well. And they are developing human resources also. All medical and veterinary people, they are coming for the trainings. And I would like to share here with that many medical people that are not much aware of veterinary public health subject, So they are also, sometimes they are astonished that in a veterinary diseases you have got so many of diagnostics, so many of vaccines, and perhaps they have been working in silos. So now that project, if you are able to develop a common laboratory for common laboratories throughout the country, in any country, maybe low or middle income country, that would be very useful. And that is also less expensive also, because if you are working on a brucellosis or tuberculosis, across laboratories, veterinary laboratory doing their own self, and medical laboratory, they are doing their for medical human purposes. So if you have got one laboratory, then perhaps the the cost of testing will be reduced, highly reduced, and we'll have a very good surveillance data that is coming out of that. So that part I wanted to mention that.
Great, thank you very much, Dr. Tripathi. Dr. Obukosia, you'd mentioned in your experience on the biotechnology front that there's appears to be these silos, particularly between, even on the agriculture side, between the plant and the animal and the environmental side. And there's interventions that are moving ahead on the plant side that might need additional focus or perhaps investments on the animal and human side. Can you briefly explain how you see, what paths forward you see to get this better coordination?
Yes, one of the most important things we realize is that as much as we talk of regulatory frameworks, it's only when there is a product to drive that regulatory framework that different type of stakeholders get involved here. In other words, if we get a product or we get a research venture that combines human health, that combines animal health, that's the only way you can be able to put those different stakeholders together and they have collaboration. In other words, it's product or research driven and it's focusing on a particular problem for specific area. One of the most important things, for example, in the integrated vector management that is being employed in Africa, this is where, for example, the health workers, the environmentalists, the socioeconomists, and the entomologists have come together to solve Africans' problem of malaria. In other words, they are a research and product driven here. And that's what brings different people together. In other words, you must answer an economic problem, then that's the way to bring partners together. Thank you.
Great, thank you, Dr. Obukosia. I'm aware of the time, and I think in the last 5 minutes, if each of the panelists could comment on what they see as the one or perhaps two things that would help move the agenda forward. Primarily because given the context that nothing succeeds like success, we do need to ensure that best practices are being propagated. After all, that's what the cooperation is hopefully going to also enable. And that these tools are actually leveraged, which we heard many of the panelists speak about. So in your mind, which would be the one or perhaps two things topmost that would help drive the agenda forward? So if you had all of the special drawing rights from the IMF, $1 trillion, what would you invest in to move, in particular, the One Health agenda forward? Perhaps we can start with you, Dr. Obukosia. You're right up front here.
Yeah, it's just two things. One, if you look at the policies in Africa, they focus on agriculture, which covers health, which covers animal health, animal and crops. But in the recent realization, a paper published, it shows that socio-economic development cannot go on unless health is an integral part of that. So one, you have got the agriculture covering livestock and animals, then without health, we can move forward here. So that brings the three together and moves the agenda forward here. Thank you.
Right. Dr. Chaturvedi, if you had that $1 trillion, what would you do?
He's not there.
Yeah.
He has to jump to some other meeting.
Well, I hoping he's spending the $1 trillion wisely. Dr. Dobb?
You said 3 millions or 3 trillions?
1 trillion. Let's do it. 1 trillion.
1 trillion. So 1 trillion, I imagine, should be for global health with a significant part in One Health. So I would promote to allocate a significant part of for One Health. which will be our challenge for the forthcoming G20 discussions within the joint health and finance group. So, and for that, we will need to coordinate together with the Tripartite Plus. And once I get a significant part of this trillion, I will fund our forthcoming global plan of action for One Health, which will include all the components that I previously mentioned through 6 tracks, with a significant part for prevention, for surveillance, for data sharing and analysis. I will respond to the question I had in the chat.
Yeah.
And a significant part, I insist, on capacity building to support our members. And capacity building will also allow to make the necessary connections between health, environmental health, and human health sectors to connect people not only during the training, but along their professional life. Over to you.
Great. Thank you very much. Dr. Smith, just the last 1 minute here.
Thank you. My feeling is that surveillance is the holy grail. The earlier we can detect things, the faster we can respond to them. Now, most high-income countries have the capacity to do this. The gap is in the developing countries. But there is enlightened self-interest for the developing countries to invest in surveillance in the developing countries, because what happens in developing countries can go other places very quickly. So surveillance, and I think we can build consensus around that quickly, because it is of mutual benefit to both developed and developing countries. The other place I would invest my money is that, given this rapid ability now to develop vaccines, just imagine if we weren't able to develop vaccines, it took us the 8 or 10 years it used to take to develop a vaccine this time, how much more this would have cost us. So I think we should continue this work on keeping the scientific community in the area of vaccine development, but not on individual viruses, but on families of viruses, so that we can have vaccines that are more universal and be prepared for the next virus that could come along from whichever family they belong. Thank you.
Great, thank you very much. I see we're out of time. I'd take this opportunity to thank each of the panelists for their perspectives and contributing to this really informative discussion. I was particularly interested to hear their perspectives on how the value proposition might be demonstrated, leveraging, if you will, or building on the awareness that's been created by this pandemic and the opportunities that have arisen because of that, both in highlighting the gaps and highlighting the opportunities for us to work together going forward. The sustained interest and awareness, I think we heard a few solutions about, and I'm really glad this meeting is recorded, since we can go back in and try and hopefully summarize what the learnings are from each of the panelists in this session. So just a big cheer out, thanks to each of the panelists for your great comments and discussion.